Welcome back to Made to Be Whole. This week we're going to talk about some of my favorite underappreciated B vitamins. Stay tuned.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
So most of you have heard of B12. Many of you have heard of folate, but did you know there's also B1, which is thiamine, B2, which is riboflavin, B3, which is niacin, B5, which is pantothenate, B6, B7, which is biotin. There's so much more. And they have so much to do with our health, our immune function, strength, all sorts of things. As far as testing, we've touched on this before. All of these can be ordered through a commercial lab. Most of the tests available are for those extracellular or plasma levels, which I don't find to be as accurate as the intracellular levels of nutrients. But if you have insurance that will cover just the regular tests, that's always a good place to start. But it's really helpful to dig in and see what your body's actually absorbing because it doesn't always correlate. So first I'm going to talk about B5, which is pantothenate or pantothenic acid. It is important for a lot of different reasons. If you go to the literature and if you do Google searches, most of the times people say, oh, it's so unusual to have deficiencies. It's so unusual to have deficiencies. But what they're looking at are these frank life-threatening deficiencies. So they're saying you can't have a vitamin C deficiency, for example, because you don't have scurvy. But isn't there an in-between optimal levels and being bad enough that you have these like really frank, severe symptoms? And what we're trying to do is push people to optimal levels so that we can prevent some of the bigger complications. And I think it is not controversial at all to say that most of us do not have a perfect diet. Even if our diet is perfect, as in we have the right balance of fruits, vegetables, proteins, macronutrients, which would be the protein, carbs, all of that. Our food supply is depleted. And then we have other chronic things that affect our body's ability to absorb things. So pantothenic acid, I am fascinated by B5. So human deficiency symptoms include fatigue, depression, burning feet, dermatitis, which is a skin condition, burning or pain in the arms and legs, anorexia, not anorexia nervosa, the eating disorder, but anorexia is the scientific term for loss of appetite, nausea, indigestion, irritability, mental depression, fainting, hair loss, increased heart rate, and susceptibility to infection. So that's a pretty broad range of symptoms that it can affect. Now, most grains in the United States are fortified with B vitamins, other nutritional sources, meat, vegetables, seeds. I love seeds for all of their benefits. If you're someone who doesn't have any difficulty tolerating seeds, I'll tell you what, sprinkling pumpkin seeds, sunflower seeds on salads, yogurt, cereals, things like that is a really easy way and not expensive way to get a little extra punch. So the recommended estimated daily intake, they say 4 to 7 milligrams, but they have shown that there's no toxicity in people taking up to 10 grams a day. So your B vitamins are water soluble, meaning that theoretically anything that's too high, your body's going to be able to eliminate and pee out. And that doesn't mean you might not feel right if you're taking not the right form of something or too high of a dose or the timing of the dose isn't right. So for example, I was reviewing supplements that someone was taking with someone who had a lot of sleep problems. And I saw we had a supplement that had some B vitamins in it. And I had given improper directions because I said, I want you to increase this to twice a day. Well, they increased it to morning and bedtime. I meant morning and afternoon, and I didn't specify that. So taking B vitamins at bedtime because it can improve energy might mess with sleep. So there's timing to be involved. There's a really cool article in the Alternative Medicine Review, which is a journal. He goes through a lot of really interesting information about pantothenic acid. But some of the things that he brings up with deficiency that we see commonly in people, I wanted to highlight. So one study reported that pantothenic acid levels were significantly lower in females using oral contraceptives compared to females who were not. Now, that's a pretty significant but widespread risk factor. So you may think to yourself, I'm eating all the right things, but is it possible that you're taking something that is depleting nutrient levels? So oral contraceptives widely used can be bringing down the levels of pantothenic acid. That's an important thing to know, and that might be a reason to supplement. The other thing I thought was interesting, especially for my population, that even people who have severe deficiencies, their symptoms don't manifest necessarily until maybe an antibiotics is introduced, but that could be because intestinal bacteria helps to produce some of these nutrients and other things that our body needs. So whenever we disrupt the bacterial flora, which is the healthy bacteria, we can have unintended consequences. It's important because if you have an infection that is literally killing you, you need to take care of it, or if you have an infection that's interfering with absorption. But we have to be aware of the downstream consequences of what we do and how do we offset the risks. So infection, a lot of people have infections, have been on antibiotics. A lot of people have been on oral contraceptives. There's a lot about the biochemistry of it that I won't bore you with, but I think this is really significant. I have a lot of patients who come to me and the language that they will use, they'll say, well, I think I have a problem with my adrenals. I think I have a problem with my adrenals. And I think that a lot of them are right, but I also think a lot of them don't really know what that means. They just know that adrenal function affects energy. When you have impaired adrenal function, you can be fatigued. But in this article, he says one of the consistent findings in animal experiments of pantothenic acid deficiency has been a progressive morphological and functional change to the adrenal glands. So, what that means is in multiple experiments, when there's been deficiency, there's been a morphological change in the adrenal glands, meaning the glands themselves change physical appearance, but also functionally they change. They've shown that in mice studies that the thymus of mice, which is one of the glands that's part of this whole system, starts to atrophy and your spleen gets bigger. Lymphopenia followed by lymphocytosis, so alterations in your white blood cells, can occur, and the ability to produce antibody titers against various infections can be reduced. So translating that a little, you will have some people, we'll use the example of Lyme disease, who really, I mean, they've got the risk factors, they've got the symptoms, but their antibody tests are negative. And then the response to that by the traditional medical community is, well, this proves that you don't have it. When in fact, sometimes they do, sometimes they don't. Not everyone who has symptoms of Lyme disease has Lyme disease. There are other things that can cause overlapping symptoms. But this is showing that those antibodies that your body makes when there's infection, that can be impaired if you have a pantothenic deficiency. In male rats, they showed that having low pantothenic acid results in increased weight of the testes. So the testicles get heavier. The sperm is less motile, so the little sperm doesn't swim quite as effectively, and also decreased levels of testosterone and corticosterone. Sometimes I can't pronounce my hormones. Sometimes with mild deficiency, triglycerides go up. That can be a cardiac risk factor. So I think it's just really helpful for us to say this one B vitamin does so many different things, because really, if you are looking at your vitamins and nutrients, having optimal levels as having a well-stocked pantry If you are a cook or you're a baker or a chef of any sort, you know there's certain things you have to have on hand because they're part of so much of what you do. You have to have salt, you have to have fats to cook with, you have to have leavening agents if you bake. And if you are missing those things, you might be able to improvise and get something on the table, but it might not be as good. And that's the same thing with every single nutrient. This isn't a matter of me telling you about B5 and then you running out and saying, oh, I've got to buy some B5. Like, obviously, this is the stuff. I have all these symptoms. What I want to do is push you to find out if any of this resonates. Do you have nutrient levels that can be optimized? So, malnourished prisoners during World War II reported numbness and burning sensations in their feet. And when they administered pantothenic acid, which is the other name for B5, that resolved. There is a classic triad of headache, fatigue, and weakness, also gastrointestinal problems, as well as sleep disturbances, personality changes. Anecdotally, for myself, when I first did that intercellular micronutrient test, I had low levels of B5, and what I was expecting the most was to see an improvement in mood by treating it. But what caught me off guard is that my acid reflux actually improved dramatically. But B5 is one of those cofactors in our Krebs cycle where your body needs adequate amounts to break down your food to create cellular energy. So, little side note there. Other things that have been affiliated with it, alopecia, which is hair loss, exposure to specific chemicals can cause that to be depleted. Sometimes, as I mentioned, if you have low B5, you can have high direct glycerides. So they have found in some studies that sometimes replacing B5 can bring it down. That's not going to happen if that's not your issue, but it's worth looking into. So a little bit about B5. The other thing that I've seen in practice is very, very commonly if a patient has anxiety or depression and they come for micronutrient testing, I'm almost surprised if they aren't low on B5. There are usually other deficiencies too, but it's very, very common to see that B5 be suboptimal. So shout out to B5, pantothenic acid. You can take it as a standalone supplement, or there are a lot of adrenal complexes that might include it because of its impact on adrenal function. One thing to recognize too, if you take a B complex, I will hear people say, oh, I take a B complex and it has B5 in it, and it says it has B5 or pantothenic acid, and it has 10 milligrams, and that's beyond what the recommended daily allowance is. I'm telling you, it's not enough. That's not going to get you out of deficiency range. That is not an optimal level of pantothenic acid at all. If we look at all of the things that it takes for that to be broken down and absorbed in your body and get adequate levels. So be on the lookout for B complexes that have more optimal levels of B5. I think every B complex should have at least 50 milligrams in it. And some of them, there's a varying range. There's one that goes up to 200, which for some people is really good. It's in those ranges, you really do not have to be concerned about overdoing it. I've also seen it be helpful in preventing postpartum depression and treating postpartum depression. So again, I've mentioned before, but I think in an ideal world, before anyone even made a baby, both parents would get tested for nutrients and see what are you missing. Let's build you up and optimize you prior to pregnancy so you have a better pregnancy, a better postpartum experience, and a happier baby. Because some of the conditions that we pass on to children, are we passing on something genetically, or are they inheriting a nutrient deficiency? Because if they came from your body and those are the building blocks that were being used, and then they're living in your house eating the same food, they're probably going to have similar deficiencies. And I've found that in my own family, as we've tested and retested nutrients, some common threads. And it's interesting because there's sometimes a split, because we'll have some of the kids that have the same issues I do, and then another portion of them will have the same deficiencies my husband has. So I don't know if that's absorption related. I don't know what all goes into that. But a lot of us are taking the same things not because I think, oh, B5 is great for everyone, but because a bunch of us are low on it. And that's a cheap, easy thing to fix. So another underappreciated B vitamin is B1. And I remember working someplace when I would recommend it, and one of the other providers said, "Are all your patients alcoholics or something? Why are you giving B1?" Because B1, which is thiamine, it is depleted by alcohol abuse. So it's not uncommon to have frank deficiencies in people who abuse alcohol that have to be on supplementation. But let's not wait till it gets that bad. Okay. So thiamine also needed to help make energy from your food. You know, your food itself doesn't confer energy. It's what your body extracts from it, how it puts everything together, mixes it up, all the processes that it feeds that creates cellular energy. It actually plays an important part in nerve cell function, including transmitting those signals, your nerves communicating with each other. So early signs of deficiency can be that loss of appetite, being irritable, fatigue, constipated, depressed, nausea, neuropathy. When it becomes more severe, you can get something called Wernicke-Korsakoff syndrome. But again, I want to catch people before they get to that. That's like a big problem. People sometimes act like you're a great hero if you find these severe deficiencies and rescue people. And that's great. I'm glad it's happening. But wouldn't we rather just keep people farther from the side of the cliff? Loss of eye coordination, weakness. So, people at risk, I think we're all at risk some, but alcohol abuse, definitely. People who are older, it's a bigger deal. People who are on dialysis, if you're on a restricted diet, and increased metabolic rate. So what can increase your metabolic rate? Pregnancy is a great example. A diet that was adequate when you are pregnant is not necessarily adequate when you are pregnant. And this isn't just about you need more calories, so go ahead and have a candy bar. You have increased nutritional needs. Same thing with breastfeeding, infection, trauma. So these immune system is very metabolically active, and you will burn a lot of calories when you're very sick or fighting something very serious. So you have increased need. Again, it's not just about pushing those calories in, it's about getting adequate nutrients. And then B vitamins in general, along with a lot of other nutrients, are an issue for people who have had gastric bypass or similar surgeries. You have less of your GI tract available to absorb those nutrients. Absorption is impaired, so you need to supplement. And you might be someone who needs to look at other forms of nutrients for supplementation, like sublingual stuff, B12 shots, that sort of thing, because you literally aren't able to absorb at the same rate that other people have. Again, you have a lot of supplements that have B1 in it, but typically not to a super high amount. Legumes are a great source, that being beans, peas, soybeans, lentils, those sorts of things. You really want, if you're doing B1, to use potassium and magnesium and electrolytes. So finding a balanced supplement in the right form is important for helping people absorb properly. There's a really interesting article from the journal Cells, CELLS, from 2021. It's called Hiding in Plain Sight, Modern Thiamine Deficiency. Because one of the things it brings up is thiamine has a really short half-life, and it gets broken down really, really easy. And it also gets depleted quickly by a lot of things that are part of our modern lifestyle. So you're talking about environmental chemicals, whether that be the stuff that's getting sprayed on your lawn or your neighbor's lawn, pharmaceuticals, which a lot more of us take than we did back in the day. Those things put you at risk for having lower levels. That might be why you have lower levels of thiamine. I think people who say, oh, these deficiencies are so rare, first of all, they're not testing for them. You're not going to find what you're not looking for, but they're also not taking into account, yes, it's the modern world. Yes, people are dying of frank malnutrition like they did in the not far distant past. But when we have this chronic sort of malnutrition, that's not necessarily somebody's underweight. You can be overweight and malnourished. You can be overweight and not have optimal nutrient levels, and that can be absolutely slowing you down. So classically defined, you're looking at alcoholism and starvation, but we talked about these other scenarios that I want to take into consideration. But the other thing that is, it's so much easier to treat something early too. It's not like if you get Wernicke-Korsakoff syndrome, oh, just give them some thiamine, everything will be fine. There's some damage done. There's some rebuilding that needs to happen. It is not hard at all to get something early and replace it and get those levels built back up. I had in our most recent round of nutrient testing in my family, some people go on vacations, the Micheners do labs. That's what we do with our money. But in our most recent family round of nutrient testing, my husband and my daughter both were low on thiamine, which they hadn't been before. Isabel's weren't great the last time around, but they were definitely low. That's cheap and easy to fix. So again, we can't assume that it's just an intake problem. What's depleting it? We can't just look for frank symptomatology. We have to look at the big picture. And one of the things that I thought was really interesting with early symptoms of thiamine deficiency is food intolerances. Food intolerances and then sometimes vomiting. So there's GI discomfort, dysmotility. So my daughter, she has had a lot of food intolerances that she did not always have. She did not always have them, but when the babesia symptoms started, her migraines started, she went from being Miss I will eat anything to just not putting things in her mouth because she didn't like how it made her feel. She wasn't being a wimp. She just knew her body and was very, very protective. And I've mentioned before, treating the infections has improved some of that, but I'm also wondering, as we tackle this more recently discovered B1 deficiency, if that can make a even bigger impact in her body's ability to take in a more broad variety of foods. So with Wernicke-Korsakoff syndrome, let me just give you a little more about that, because this plays into our last episode where sometimes things get labeled as psychiatric when there could be a very real fixable physical problem. So early symptoms, there's organ involvement. It can be cardiac failure and edema can be part of it. Then you get that mental confusion, vision problems, affected gait, which I mentioned. But then what you progress to psychosis, confabulation, things happening in your head that aren't happening other places, making stuff up, and significant memory deficits. But I can easily see how this could be missed if there was someone who you think, well, they're not an alcoholic. They get fed every day. They have a family who takes care of them. But what if we have an elderly person who suddenly develops this presentation and they were non-psychotic before, don't have a history of psychosis, and now they are. They have dementia symptoms that we don't want to just say, well, it's just dementia, they're older. God willing, we're all going to be older, but I'm pretty sure we don't want dementia. So that's really, really low-hanging fruit when you have problems with mental health in all populations, but I think a lot about the elderly, because think about how the number of risk factors is not only increased, but accumulated. So if you have environmental chemical exposures that can decrease your thiamine levels, well, if you've had them for 80 years, that's a lot more stuff. What about pharmaceuticals? People take more drugs at the end of their life than they do in the early and middle stages of their life. So if you've got more pharmaceuticals on board that can be further depleting you, that's another reason you could be at risk for something that doesn't fit that classic presentation of starving in Africa or you are an alcoholic. With the elderly especially, I feel like so many things are missed. Look to nutrient deficiencies. And if it's anything neurological, psychiatric, anything along those lines, even if you can't get all the testing done, start with your B vitamins. That's a really, really great foundation. Because of the vagueness of the symptoms, a lot of times testing isn't triggered until there's something severe, but test early. And again, keep in mind that the plasma levels, the ones that aren't my favorite, they contain only a small fraction of circulating thiamine relative to the erythrocytes, which is the red blood cell, and are sensitive to recent intake, meaning it's not a great reflection of what might also be there. And it also is going to fluctuate a lot based on what you had to eat that morning or the day before, or if you took a supplement versus the intracellular level, which are looking inside the red or white blood cells, depending on the test you use, is a much more accurate long-term indication of your thiamine status. I'm going to cut off there because my other vitamins I have a lot to say about too, and I don't want to get interrupted midstream. Today, you have been hit with B5 and B1, and you know more than a lot of people taking care of you about these particular nutrients. Always keep in mind that nutrition is low-hanging fruit. Even if you eat a perfect diet, you don't. But you also don't live in a perfect world. So there are things working against you. Don't be afraid to dig in because this is easy to fix and actually a pretty cheap fix. It's a lot cheaper than a nursing home to fix the thiamine deficiency. So remember to have hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.